Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Oh, I see. Yeah, I'm still recording. You're right. And Darryl, you can record also. There we go.
Yeah, I'm recording.
Okay, cool. All righty.
We talked about this last week, but John thought we should talk about it again. The fact that chronic disease and death is related to plastic chemicals is something that we talked about last weekend. I guess the issue is that the nanoplastics are so small they invade the body's cells, and we don't seem to be aware of it, and it's causing obesity, diabetes, and heart disease. And what are we going to do about it? That's really the question. How in the world can you overcome it? And so some people talked last week about, I think Darryl talked about having putting water in. What did you put it in, Darryl?
Well, I don't know. I'll keep talking. I'll pick up the thread.
Well, remember, you had mentioned that you didn't use plastic for your water, but you put it in another kind of container of the
Oh,
water.
yeah. Steel line container. Steel line
Yeah.
water bottle.
Yeah, that's right. And so there are other ways of doing it, but first you got to recognize it's a problem, because most of the water comes in plastic containers, and we buy all of those distilled water things, and they all come in plastic containers, and all of the plastic has these nano products that are getting into our blood and are causing us to be diseased. And so this is something that is frightening. And I think as we closed last week, we talked about what are you going to do? And any time you microwave anything that just got plastic, it gets in your food and gets in your system. And and of course, they're suggesting that this is one of the major reasons why we're so fat, because half of the American population is overweight, and a third of them are morbidly obese. So, and then they talk about the phthalates that are causing all kinds of issues relative to reproductive malformations and undescended testes and other things. So, and the phthalates are found in just about everything you can imagine. And so, how are we going to overcome this?
Yeah, it takes a lot of diligence to overcome it. And I've been traveling the last 3 weeks. So I didn't bring a water bottle with me. And to get water at the airport, you got to drink, you got to buy a bottle of water.
Right. Right. Yeah, they really got us. And I think the problem is that they weren't aware of the fact of, we hope they weren't aware of the fact of how dangerous it was going to be, because they didn't know about all these nanoparticles at the time.
Yeah. Back up, and earlier in that article, it was talking about makeup as being a major source of phthalates.
Right.
And, there's some healthy makeup that you can buy. I don't know what the price of it is because I don't wear makeup. But if you track the ingredients in most common makeups, it's there's a lot of toxins in makeups.
One thing that we didn't talk about last week, the last time we talked about this, about when you're taking medicine by capsule, the medicine is inside of a plastic capsule. Is that correct?
I don't know what the capsule is.
Yeah, the
I
Uh,
capsule
can't answer that question.
is plastic.
no,
I don't know.
No, it's not plastic. I think it's psyllium, isn't it?
I don't
no.
know the answer to that question. So
I think it's gelatin.
somebody,
Yeah,
Gelatin, right?
yeah.
I have to do some research on that. When I encapsulate herbs, I use it looks just like the capsules that you get your pharmaceuticals in, but it's all vegetable product that I use. I don't know what's commercially available, but what I use is all vegetable product.
I doubt that it's plastic, but I don't know the answer to that one. But it's clear that we have a situation that really has not been addressed satisfactorily yet, and that virtually everything that we do is associated with nanoplastics, and so this is something that we have to try to overcome. We haven't found a solution yet. So the next papers we need to look for are not what the problem is, but what is the solution, and that's something that we have not come around. But it's clear now that we have uncovered another uh, toxin that we were unaware of, and that toxic is water bottles of plastic. So
Google says that capsules are made up of gelatin, hard or soft, and non-gelatin shells generally derived from hydrolysis of collagen from animal origin or cellulose based.
thank you, Darryl. Thank you. Okay, let's go to the next one.
Just one last thing. I'm trying in our home to eliminate the plastic, like the microwave cover. I went and got a glass microwave cover. I've stopped plastic cups and getting paper cups rather. But so much stuff in our household is made of plastic when it comes to cooking and containers to put up stuff. So then I got containers that were glass. They got rid of the Corningware and that was all glass. So it's just trying to find something to store your food up in. But those little plastic containers, it's so cute and so convenient to use to store your food. But we're trying one thing at a time. But of course, when you go to grocery store, there's plastic everywhere.
Okay, this article is talking about sparkling water, and I don't really know much about it. I know about the carbonated soda industry, which is remarkable in terms of its expansion. But seltzer water uh, can occur naturally, as we know. And the question is that safe? And I guess the answer to that question is that probably as long as you don't use the artificial sweeteners, that it's a good choice.
What doctor told me that carbonated beverages cause gas.
Yeah. Well, and I guess the yeah, I guess they can cause gas because the principle is it's gas in water. So, but seltzer water is apparently uh, and this says it can make acid reflux worse. So I don't know how it works with people who have GERDs. Uh,
And you got to keep in mind that most of the sparkling water comes in plastic bottles.
Yeah. So
You can make your own
make your own what?
seltzer water.
Oh, okay. Yeah.
Yeah, I have a machine that does that. You buy the uh it's a compressed bottle of gas and you put it in the machine and put water in there and it puts it makes the water carbonated.
Mhm.
What
Is the
does it do for the
machine made of
taste?
plastic?
Say it again.
Is the machine made of plastic?
The machine is, yes.
What
I was
what
just
does it
thinking
do for
about
the
my
taste?
food processor that I truly love and is made of plastic.
What does it do for the taste, John?
Well, it doesn't affect the taste at all, but you know, they come with all kind of
Flavor.
fruit flavors you can add to it, you know.
Oh, I see. Okay.
They come in separate bottles, so you put that in there and put it in the fridge, and just like making your own soda or fruit punch, sparkling fruit punch, whatever. But now I'm thinking about it. I never thought about it in this way.
Okay, let's go to the next one. Oh yeah, this is very similar to the article we did last week that talks about how increasing plant-based protein just eliminates the amount of refined carbohydrate and unhealthy fat that is in your meat. And so there's many reasons why plant protein are preferred over animal protein. And there's no question that animal fat does give you all of the amino acids that you need. It's just that they also have in there the unhealthy fat as well as refined carbohydrate that is not so good for you. So that if you had a choice, of course, lean meat is good, but if you had a choice, the uh, plant protein seems to be better for you than the animal protein, although uh, lean meat is just probably just as good. But that's a subject that has been uh, researched very well. I actually just studied, I'm talking about here, they studied uh, thousands of women actually. And the question I had is if it's good for women, why don't we recommend it for men also? Women live longer than men. And so if it's good for women, then it must be twice as good for men. But anyway, but the study was done in women, and it pointed out that the plant-based protein for every 3 grams of plant protein that you took instead of animal protein uh, made you healthier. And it pointed out that the diseases that are associated with animal protein actually are at least 7 or 8 cancers. And these are the products that they think are most beneficial for plant-based protein. What beans and nuts are two of the things
Uh-huh.
that are important. They, it's amazing how important the beans are in terms of the chia seeds and the lentils, chickpeas, tofu. All of those are the ones that are the richest in protein. Uh,
Uh,
and
number
yeah, go ahead, Darryl.
number 2 on the list, chickpeas. That's got the 14.5 grams of protein per cut, and that's the leading source of protein. And it is a bean. It's called garbanzo bean, but it's very mild. Doesn't create creates hardly any gas at all, as opposed to things like lentils, navy beans, black beans. Um, and you can serve it in a variety of different recipes. So if you're not into chickpeas, you might want to check it out.
Okay. The cancers it's associated with are actually the prostate cancer, um, breast cancer, uh, and colon cancer. There's about 7 or 8 cancers that are associated with the animal protein that are not associated with the vegetable proteins. So it's very clear that as you look for a healthy diet, diets that are associated with vegetables and fruit are most desirable. And it doesn't require that you eliminate meat, but it just requires that you try to, if you're going to eat meat, eat lean meat. But if push comes to shove, you're better off with the plant-based proteins. What are your thoughts about this group? We've had enough articles on it now. What are your thoughts? These are the data that they've shown us that are overwhelming from the research. What are your thoughts about it?
Good morning, everyone. I definitely have been eating more salads since I started listening to the group. Not as many meats as I normally do. I love salad and I've been eating more of it. That's a start.
Any other comments?
Good morning, everyone.
I hear a lot of people saying they eat a lot of salads, but it's according to what you put on that salad can be just as detrimental as eating a lot of meat. So if you're adding a lot of fats and et cetera to it, and I don't know, I could ask someone, is lettuce really that much better for you? Because I've heard that it has practically nothing in lettuce
it's
to
not
really help.
It's not the lettuce, it's what you put on the lettuce. It's the salad dressings. And so you need to look at what salad dressings you use because they're very healthy salad dressings, but they're also very unhealthy salad dressings that possess a lot of cholesterol that's undesirable, the so-called unhealthy fats.
Yeah, Carol, what you're talking about is iceberg lettuce, which has far fewer nutrients than things like romaine, arugula, or other greens.
Any other comments?
Oh, and what about spinach? For a while, they had something alarming about adding spinach.
Spinach is thought to be it may have oxalates in it, but spinach is also protein rich as well.
Yeah, uh, there were some E. coli strains a couple of years ago that went through spinach, so there was a warning about that. Spinach is another man-made hybrid vegetable, uh, which if you're trying to avoid that, then you avoid spinach.
One of the
Good
things
morning,
I've been
Dr. Callender. I was trying to think of the word that getting back to the beans. I was trying to think of the word that they were saying that make sure that you, if you can cook the beans in a slow cooker. What I say is just I remember my mother and my grandmother cooking those beans almost all day long. And so that's one thing I've learned in my research, that the length of time that you have to really cook those beans, there's something in the beans that has to be released. And I can't think of the word, but you have to really cook those beans. And they suggest a slow cooker, or you just cook them long so they're well cooked.
Yeah, that's true. Beans have to. There is a. I can't think of the term either for what has to be released in beans. There's a little faster way than a slow cooker, and that's well. First thing you got to soak your beans. You just soak them overnight, but you can reduce a lot of the time by putting them in a pressure cooker. So I
Yeah,
soak mine overnight. Pressure cooker. Generally something like 20 minutes on high in a pressure cooker and 10 minutes for a release. And that's a whole lot better than slow cooking them all day.
Any other comments on this important article?
One of the things that I've been doing is making my own nut mix, and I combine the walnuts, the almonds, the Brazilian nut. Well, not so much the Brazil nuts, and I use only nuts that don't have salt on it, and I add a few cran cranberry um, cranberries to the mixture, and we use that as a snack and limit the portions to like a handful of the nut mix and have it as a snack in the evenings. And that seemed to curb our appetite.
Any
One
other
thing that people
comments?
do when they try to increase a plant-based diet is they go to beans and salads, which gets really boring if that's all you're doing, unless you're loading up your salads with a lot of stuff that's bad for you. Um, But as an alternative to that, if you go in the produce section and you look what's in season, what you've just never tried, try something different. You know, there's a lot of things like bok choy that have a wonderful flavor, wonderful taste. Um, but you buy things that are in season, Jerusalem artichokes. If you don't know how to prepare them, just do a Google search on how to prepare them, and it gets a lot of variety. Um, and you know, it's a whole lot better than getting bored to death from beans and salad.
Any final comments? Well, let's go to the next article. This is a very important article, and uh, this is a patient received a brain implant. The question is uh, for what? But the goal eventually is to try to overcome people who are paralyzed. The fact that it's recovering well does not address the issue of why he got the implant, because the question is it going to make him walk? Is it going to overcome why he's paralyzed? And so this is the first step in trying to address a problem that we have not addressed satisfactorily. There's few and far between the cases that actually recover from paralysis from ALS and diseases like that. But this is a beginning of something that may turn out to be helpful. But it's too early to say. But at least the first implant has been done now. The real test is, will it work? And that's down the road piece. But this is a start.
Dr. Callender, could you explain to us in layman terms, what is a brain implant?
Well, it's okay. The purpose of this, we're talking about people who are paralyzed, can't use their extremities, upper or lower, and this implant is goal is to knock out those impulses that prevent you from being able to use your extremities. So first, you have to do the implant just to see if you can do it without hurting the patient. And then the goal is to have the implant to block the negative impact of ALS, which paralyzes you, makes you impossible to use any of your muscles. So in
Okay,
many,
I understand like tooth implant, they go in your gums, they put in a little whatever, and then they let that heal, and then they screw in this tooth. Now, a brain implant, what are they putting in your brain?
they put uh, a, a, a piece of metal that tries to block your the impulses that are blocking your nerves from functioning. And so it's not like that tooth implant at all. It's more like, and they have implants of all kinds of things, but a brain implant, they put in a device that is supposed to overcome the negative effect of amyotrophic lateral sclerosis, which results in you being unable to use any of your extremities, and you eventually die because your muscles don't work and you asphyxiate. As well as none of your muscles work at all, any of your muscles work at all. And this is the first step in trying to put in something in your brain that blocks the those negative influences that paralyze you and prevent your muscles from ever working again.
Dr. Callender, my question on that same line is that um, when when a dentist puts a implant, um, it's not it's not in the area of electrophysiology, where if you put a piece of metal in a brain, uh, what kind of a surgeon does that? Not what kind of surgeon would do that? What is the name of that surgeon?
Well, it would be a neurosurgeon, probably, because anybody who works on the brain is usually a neurosurgeon, or
But I mean,
works on the nervous system is usually a neurosurgeon.
yeah, I was really asking about the field of science. Is some kind of electrophysiology when you use
Well,
it?
there are two aspects. One is the uh, constructing the implant, which is a really basic science, and this brain-computer interface is kind of like a robot that blocks the efforts to paralyze you, that prevents you from using your muscles. And this is just the first step, but this is basic science that is applied to the brain. So far, we've done nothing that works in addressing brain diseases. We haven't done anything effective for Alzheimer's or any other brain problem. And this brain-computer interface link down the road is intended to do that.
Dr. Callender, I think it's analogous to a computer chip,
Yeah,
and they're able to communicate with it wirelessly. I don't think that they even have
that's
to have
correct.
uh, an electrical connection. You could do it wirelessly. So
Dr. Callender, I heard you reference different diseases that they're trying to cure. Would would this implant also help victims who have been shot or something like that, that would
Who are paralyzed, yeah.
anybody, anybody that's
Yeah, it is. Of course, we don't know exactly, but it is intended because, as a matter of fact, there has been one case where they did put in a chip that did overcome paralysis for somebody who was shot. But this is just one in a million. So yes, down the road, it would benefit that person who was paralyzed because of traumatic situations. Uh, but actually, this is intended to address those people with ALS, which is Lou Gehrig's disease, for which there's absolutely no cure. Next one, please. Well, this is what we're going to face now. This is, you know, we've had a period in which the Supreme Court is trying to overcome its its mistakes that it's made in the past with segregation, and now we are in a situation where the Supreme Court now has done away with the diversity rules. And so you have a governor who's sued because they still have diversity rules. And then you have a president of Cornell University who's going to be asked to resign because he's too slow in eliminating the diversity standards. And this is something that we're going to be facing now, is the backlash that occurs because they've done the right thing. And now that they're trying to go back on it, they can't wait to jump right on it and get everybody to do away with all of the diversity rules. When in point of fact, the best thing we can do for the world is to make it more diverse. So diversity begets ingenuity. So this backlash is going to hurt things, and so they are rapidly trying to eliminate any diversity effort and trying to. And what's going to happen is that whatever gains we've made, they're trying to do everything they can to overcome. I thought it was interesting with the president of Harvard, it was a black lady, and we had three people who testified. And what I thought was most remarkable at the end of the testimony, they had the picture focused on the black lady. And I looked at that and I said to myself, does that mean they're focusing on her when the three of them and two of them are white and one is black, and the only person they're focusing on is the black person? And lo and behold, that's what they've done. And that's what we're going to see come to pass over the next few months and years with colleges as well as everything else. And then this is a good example.
Yeah,
Sad,
as
this
much
is
as
our future.
as much as I love that last article about the brain implant, that's Elon Musk owns the company that developed that, and he's one of the biggest critics of diversity, equity, and inclusion, and it's become code words or dog whistles for racism and sexism. The big thing that the right wing says about their pushback on diversity, they say if you see a black airline pilot, he's probably not qualified because he's just an affirmative action pick. And so that's their criticism of diversity. Any person of color, any black person in a high position, their automatic thought is that because of diversity, they're not qualified.
Sad but true.
The thing that this reminds me of is the Baki decision, where Black people were getting admitted to colleges, to your point, Darryl, and they might not be fully qualified, but they had to admit them in order to have some kind of diverse representation in the college. So then Baki came up and said, well, you're discriminating against me because I'm more qualified and you left me out of the equation. It just reminds me of this, that's all.
Yeah, well, we know we have to
Exactly.
be twice as qualified to get half as far. So anytime you
Right.
see us in a high position, we're doubly qualified than compared to anybody else.
That's the facts of the matter.
Yeah, and the other thing they say too on that point is that a Black man has to wear a three-piece suit and tie in order to get the same job that a white man can get if he's in casual and jeans and stuff.
Any other comments on this interesting article that's futuristic in terms of where we go from here? It's interesting because the historically black colleges are probably going to be busier than ever now because many of the so-called white schools will not be accepting as many black students. So the historically black colleges should have a surge.
The only way to alleviate all of this is to take off every application what race you're in. And then that leaves a ball game wide open. So it appease everybody. So if you're doubly qualified and this other person isn't, and you're not basing it upon race or friendship or cronyism, all you're doing is basing it upon the qualifications. They don't know who they're gonna get in there. They could
That's
have
not gonna
it.
happen.
Okay,
Not
so
quite.
huh?
That's not gonna happen.
Their name,
Yeah,
the
yeah.
name.
Because if it's LaQuisha Johnson versus Becky Raisman, I bet you Becky will get the job.
Yeah.
Well, they could do like they did at IU. You know, a lot of our classes, well, that was also that way, was your social security number. And somehow when I was in a class of 500, because the school is big, of a history class, and I did not have, I don't think, an ethnic name. But anyway, this one teacher pointed me out in a lecture hall because I was the only one in there by my name. And I said, it must have been something by your social security number to identify you.
This, just a note, social security, numbers are issued by, states. Certain states have certain numbers. So that's a note. But also, Dr. Callender, when we were all talking, the first name that came to my mind was Charles Richard Drew. What happened to him?
Yeah, well, that's a good example. He had to resign because they wanted to not give, they wanted to discriminate against black blood, and he refused because that made no sense. And so he resigned from the Red Cross, which is a tragedy because he actually is the father of the blood plasma, and of course that has saved millions of lives by now. And that's kind of the world we live in. But the irony of it is that you can't find a state that doesn't have an acknowledgement of Charles Richard Drew and what he did with blood plasma. But that's exactly what comes to mind in this world we live in. Okay, let's go to the next one, unless there's an additional comment.
He was a Washingtonian too.
Hey, was he ever?
Yeah.
Right. Hey, this is an article I put in because we talk about broken heart syndrome, where your heart is broken, and so you get a heart attack and you drop dead. And, some people didn't want to believe that this could happen, but actually, this is a syndrome, attack of stress-induced cardiomyopathy, and of course, this does not involve people of color, but anyway, it's Scottish population, but it is associated with 91% women, you see here. And there was an increase in deaths among the people who had the stress, whatever the stress was, whether it's a broken heart or something like that. It was stress anyway. And so for those who didn't believe you could die from a broken heart, this is evidence that stress can cause almost anything. And yes, it can cause you to have a heart attack.
Dr. Callender, good morning, everybody. This is Sylvia. Could this be almost the same thing as depression? In terms of
Well,
saying you have a broken heart?
Well, yeah, I think any stress, depression may often be a consequence of stress, but because when you talk about anxiety, that's stress, and so it's not depression per se, but it's really more of you having a stressful situation that stresses you out so much that you drop dead. So this is different from a depression because this is more of a positive correlation with something that happens that is so stressful that your heart, you have a heart attack. So that's a common way of putting it.
Oh, okay. All right. Thank you. Hmm.
If we can think back to when we had our first love and we broke up, we felt like we were ready to die. So I can understand.
Yeah, that's good. Yeah, yeah. And many people actually, back to our point, many people then became depressed and may even have killed themselves. You know, some people jumped off the roof and all that kind of thing. For example, I remember there was a case when one of these young ladies, there was a guy who wanted to have her, so he killed her boyfriend. And so she, in return, just jumped off the roof because she couldn't stand it. But so that's how depression will do it. But this is saying that actually you're so stressed out that your heart stops working.
Would this would this
there's a
syndrome
lot
be
of
more
there's a lot of country music based on this theory.
would this
John,
syndrome
were you
be more
saying something?
prevalent? Yeah, will this syndrome be more prevalent in the elderly, where your mate of a lifetime dies, and you hear so many people that say, well, the husband died and the wife died of a broken heart a month later?
Yeah, yeah. I recall a situation where uh, the husband died on the stairs, and the wife died seconds later. So as a result of the fact that her husband died. So yeah, it happens like that, and there's data that shows that within the first year after the death of a spouse, if you don't marry again, that the likelihood of death is very likely. That's why some people, after they lose a spouse, they can get another one quickly. Some would argue that's not really the case. They say they had that person already lined up. But anyway, that is an observation that has been made. Any comments, additional comments?
John Tatum, didn't you have two cousins that died like that? The
That,
husband died, and then a few days later, the wife or the other, or
Yeah, but then
something like that.
oh yeah, yeah,
One
yeah.
of your Vinny cousins.
Yeah, the Veenies, right. Yeah, I heard a statement one time that said husband and wives die within 2 years of each other. I don't know how true that is, but there are
That's true.
that's many cases when it's happened like that. Yeah.
1 or 2 years, yeah. Yeah. Some
John,
data suggests it's a year, unless you get married again. That's the other option. If you marry again, then it doesn't apply. But if you don't marry again, it applies.
Yeah, that's a caveat. Oh my
I'm
God.
going to tell you a true story about getting married again. My stepfather had been taking care of his sick wife for like 20 some years. And when she died, he started talking to my mom, and eventually he asked her to marry him, and she wanted to wait a year. She said, well, your wife just died a few months ago. Let's wait a year. He said, well, I may be dead in a year. So anyway, he convinced her to go ahead and marry him. I think it was like maybe a 6 or 7 months from the time his wife had died. And mind you, they were elderly because my mom was in her 70s when they married. And he was older than her. He was a World War I veteran. And this was in 74. And he lived 15 more years. My mother. So,
He was right, huh?
that yeah, that was.
In other words, he lived 15 more years than your mother.
No, he lived 15 more years after they married.
Oh, okay.
After they married. Mama lived longer than that, but he lived 15 years after they married.
Okay.
Amazing.
Yes, and he
Amazing.
ended up, he was 96 when he passed.
Wow, amazing. Thanks for sharing.
Dr.
Yeah.
Callender, I think I'd like to address like, when one of the spouses passes away, the other spouse, who does not, pass away, I think it's important that they surround themselves with other individuals, you know what I mean, and get more involved in different activities. Because I know my mom, when my father passed, I was asked, Mom, you think you'll ever marry again? I'm like, no. It's like, okay, like, no, I'm content. But she got more involved, like in her church, and another other individual, same thing. They got more involved in different things, and so that depression was not always there. And so I say it's important that they don't always marry again, but they just try to. It's important that they surround themselves with family and other activities to keep them busy. But I know there's one guy at my church, his wife passed, and he every time he sees a person, he's like, "Hey, how you doing? I'm looking for a wife." So, it depends on the individual. And everybody's like, stay away from him because he wants to get married again. So, it depends on the individual, but it's important, when that other spouse does leave, that surviving spouse actually keeps themselves busy, or you help keep them busy, get them involved, stay around them, and just keep continuing to do things with them. Like my mom, she had a challenge of doing finances, which she never ever did while my father was alive. And so, working with her, trying to overcome that problem, she was challenged with it, but she did overcome it. And just trying to work with them and keep yourself involved with the spouse that survives is important, I think.
Sylvia, you make a good point, because if you choose not to remarry and you surround yourself and can keep from being lonely and depressed, surround yourself with our families and friends and all, that's one side of it. But then the other side is that if you do get married again, then your time is going to be, you're not going to be lonely, if you get married again. So you're going to be around that another person. So yeah, those two activities I think are good.
Just a sidebar, my dad had died 8 years before she remarried, but she did keep herself busy because she moved in with me and helped me raise my kids.
Yeah, keeping busy keeps you from being lonely, keeps you from being depressed.
Okay, let's go to the next one. Yeah, this is something that we've talked about for the last 3 sessions, and it's pretty critical. The reason we're talking about it because it gets worse all the time. And they're very concerned about the fact that without blood, trauma patients won't survive. People who have cancer operations and many other operations won't survive. So that we're desperately in need of young individuals to donate blood. And this is the third week we've talked about it, but it's because it's getting worse rather than better.
Yeah, Dr. Callender, this is Sylvia again. I know the last time we had this article, I was mentioning that, every time I tried to give blood, that, I was rejected. But I went and bought John's vitamins, the B-tron C. So I've been taking that for the past week or so. And I made an appointment to give blood on the 9th of February. So I'll see if my whatever levels come up so that I may be able to give blood. Because I used to give all the time, but for the last several times I try to give, I've always rejected. So I'm going to see if taking the iron pills will help me out.
Yeah, it'll be interesting to see. Keep us share it with us as you take your steps. That's just 2 weeks away.
Yes.
Okay.
Yeah, the article, and it says, and I thought this was the case, that COVID has slowed giving blood down, has slowed it down.
COVID, yeah, well,
That exacerbated the problem.
yeah, right. Mm.
Yeah, as an NIH donor, um, you know, before COVID, we could just, you know, call and go in and, you know, do a donation. Since COVID, you have to come in, you have to get screened, you have to wear a mask the whole time you're in there. Everybody in there has a mask on now. Uh, so, you know, they're being cautious. Plus the screening process now, you know, takes you through so many different precautions. You know, the medication you're taking, the people you're around, you know, whether you had an accidental stick, whether you get blood, you come in contact with somebody else's blood on any level. Uh, you know, your relationships. I mean, they're really getting uh, picky about it, and you know, they're trying to avoid, you know, contaminating the resources, you know, the blood resources. So
Yeah.
yeah,
And
it has definitely changed.
you can't go in there sneezing and coughing and stuff.
Oh yeah.
Blood donation is known to improve skin aging due to the reduction of skin iron. So you donate blood, you'll look better, you'll look cuter, skin will be smoother. Look at
All
John
right.
Buchanan. Look how smooth his skin is.
Okay, next article, please. It's amazing. Many things have been occurring since we're doing gene Cas9 and genetic interventions. Many things are now occurring that never happened before. And so here's a guy who was born deaf and was turned out to be a genetic disease, and they injected a gene that knocked out that gene, and lo and behold, he could hear again.
Wow.
Of course, this is something that's never happened before, and this is just an example of what happens with when you actually interact with genes. Now, here's the only thing about this that we need to be aware of is that we don't know what is the downside of that in terms of what's going to happen with when we add new genes and knock out other genes 20 years from now. We don't know, 5 years from now, 10 years. But but still a good idea to interact when you have diseases that certainly cause deafness or blindness or threaten your life. So, and therefore the gene therapy is something that is to be used judiciously. And this is a good example of the benefits of gene therapy. And this now is becoming much more common than ever before. As you know, the CRISPR-Cas9 inventors got the Nobel Prize, I guess it's 3 years ago in 2021. And so this is something that we're going to see more of. And we talked recently about the fact that this will cure sickle cell disease and will cure thalassemia as well down the road. And it's also making xenotransplantation possible. So there are many things that are going to occur as a consequence of gene therapy. The question is, what's the long-term consequence, and that's something we just have to wait and find out. An
Dr.
example,
Atto has his hand up, Dr. Callender, Dr. Atto.
yes. Dr. Atto? You're muted.
You're
You're
muted.
muted.
Gozi, you're muted.
We can't hear you.
Okay, can you hear me now?
Yes.
Good morning, everybody. This is very interesting. This is a very interesting topic. I'm just wondering, does anybody know the method of delivery of the therapeutic gene into the host? Is it by IV or oral or otherwise? The method of delivery.
In this case, I don't know, but it's usually by IV. But in this case, I don't know.
Okay.
It's such a rare cause of congenital deafness. They don't say in this article. They don't say in this article how they administered it.
Okay. Very well.
Most of the articles, they don't go into the details
Yes.
of how they administer this
Yeah.
gene therapy.
Mm-hmm.
It implies that it was done in the air, but it doesn't specifically say so.
Okay. Mm.
It implies that, but it doesn't really say so. But that's an amazing accomplishment, going from never hearing a sound and being able to hear again. Amazing. Miraculous.
I saw something that said an implant,
Mm-hmm.
but I don't think it was talking about the gene therapy. It was talking about
Cochlear implants.
Yeah.
So something that said injection too. I didn't.
Mm-hmm.
Fancy.
Mm-hmm.
Hearing traffic noises just days after the treatment. It's amazing.
Mm-hmm. Very, very interesting.
Yeah, it's amazing what we're going to see. You know, it's interesting. We have talked about the APOL1 gene
Mm-hmm.
is associated with kidney disease.
Mm-hmm.
And many people aren't aware of the fact that that same gene actually protected Africans from sleeping sickness.
Yeah.
And we now know that gene, which is great for elimination of sleeping sickness, predisposes you to kidney disease. So the question is, as we do this gene therapy thing, will this have a downstream effect that we're not aware of at this point? But it's something that we'll learn about.
Mm-hmm.
It's amazing how we take some of these gifts for granted: seeing, hearing, feeling, touching. You know, forgetting what a great gift it is. There's an article about the deadly fungal infection that's on the rise. Seems like there's always something on the rise, whether it's a bacterial or fungal infection or viral infection. One thing is clear that people with weak immune systems are far more likely to get any of these infections than anybody else. Kind of pointing out that we're all dependent upon a competent immune system to keep us alive. Actually, it was first identified in 2009. So
Dr. Callender, wasn't there another, I don't know if it was a fungus or a bacterium called Candida? A different,
Candida is one of the commonest uh, uh, fungal infections. Yeah, there's a number of Candida infections. This just happens to be one of them. But this is not. This is of course, uh, Candida albicans is probably the commonest, but there are a number of Candida fungal infections. Why Seattle? I don't know.
remember that's where the COVID started to show up. Remember the choir rehearsal? 6 people died from it. You know, right in after a choir rehearsal in Washington. I think it was Seattle, but I'm not sure.
The state of Washington, you're right. My sister lives in Redmond, Washington, which is a suburb of Seattle. But yeah, I remember that vividly, man. That was a very scary. And that's when we talk about herd um,
Immunity.
yeah, herd immunity on this group session.
Okay, let's go to the next one, please. This is a medication that was used for type 2 diabetes, but one of the things that came out of it was that this tirzepatide actually protected the diabetics from kidney disease. And so this now is being looked at as a new treatment for patients who have kidney disease and diabetes, which the number one cause of kidney disease in the United States is diabetes. And so this then makes for a good therapeutic treatment for people who have diabetes and those who don't have diabetes, but have kidney disease. So this is something that is shared so that people with other diseases can benefit from it.
Dr. Callender, we say that Black people have higher rates of kidney disease and diabetes.
Correct. Yeah, 2 to 3 times the incidence of whites, right? And diabetes is the number one cause of kidney disease, with hypertension being number 2.
A little short story. My daughter has pancreas cancer, and I'm sorry, she has diabetes. Big difference. And the doctor, and I talked to Dr. Powell about this. One of her doctors told her that she had type 1 and type 2, and she was taking this new drug that came out, Ozempic, and she said it was helping her. So, I mean, when something's helping you, you leave it alone, I guess. Dr. Cowan said he didn't know how a person could have type 1 and type 2 at the same time. So,
Okay. Well, this is kind of even more frightening than ever that vehicle tire dust produces microplastics that go into the ocean and contaminate it even further. So this is a shocking development. It's not bad enough that's in the plastic in the water, I mean the bottled water, but vehicle tire dust produces ocean microplastics. So that's something that I don't think anybody ever thought of. I don't know. It's amazing what they find out. But There's in the UK. 1 trillion particles for every kilometer driven. That's shocking. Wow. And they found in marine animals, so they impacting the animals, marine animals. So just like plastic bottles are affecting us, the ocean microplastics from the tires is affecting the marine animals. It's amazing. Wow.
Yeah, I want to comment on that too because with my clubs and organizations, we scuba diving, pay a lot of attention to the plastic that's going into the ocean. But this is the first time we heard about tire dust. I didn't even know tires were made out of plastic at all. But the contamination affects the coral. Fish eat the coral. Bigger fish eat those fish, and then we eat the bigger fish. So that tire dust, when you eat fish, ends up in us. So that's another source of plastic that gets into our system. There's a video on here that I wanted to look at, but I think we should save it if we have time at the end.
Okay.
Yeah. So, in my mind, that raises a question how much of car tires are made of plastic? And Google says car tires are made from around 24% synthetic rubber, a variation of plastic made using petroleum byproducts that breaks down as the vehicles travel.
So that's why I feel so rubbery.
Well, the rubber is the good part of a tire. That didn't the rubber never caused anybody any harm. It's the synthetic rubber, it's the plastic in the tires that's causing the damage.
Okay, let's go to the next one. This is the interesting article that tries to help you to the 10 places you like to catch COVID, according to one doctor. As the number of cases of COVID is increasing. And they mentioned first theme parks when you go to Disney World and places like that. They have that as number one. And go on down the list. Zoos and aquariums, number two. Movie theaters. How many of you wear masks in movie theaters?
I do.
I don't go to movie theaters. I stream at home.
Okay.
I know
Yeah,
sports going to come up.
I haven't been to a theater since before COVID.
Long before.
Well, nowadays, and when I go to the movies, there's very few people in the movies, especially if you go after 4, it probably have more people. But so it's not like it used to be. It used to be crowded. Not as crowded.
Yeah.
Indoor
They
place.
do matinees for senior citizens.
Yeah.
And Dr. Callender, they now have you have reserved seats.
Yes, that's correct. Yeah. And public transportation. Number 5. I don't take the subway anymore. I used to take it all the time. Since COVID, I have been not taking any public transport, not often, very rarely. But that's it's a great source.
I wear gloves when I go on the metro.
Number 6 is airplanes and airports. I think airports are really. I'm not so worried about the airplane because they have good ventilation, but the airports are notorious. Grocery stores. Well, it seemed like about a third of the people nowadays in grocery stores are wearing masks. Hospitals, not so much anymore. Certainly on the wards, yes. But I encountered one of my friends who came to the hospital. They're not giving out masks anymore when you come to the hospital. So hospitals are gaining a source. Schools and daycares. Daycares are notorious. Fitness centers, I'm surprised at that. But then, I mean, I don't know, maybe we'll go to fitness centers. But I know one of my friends who got his osteomyelitis from the fitness center.
Or I go to the swimming pool, the public swimming pool.
Yeah.
It would seem like, if you're sick, you wouldn't go.
Yeah. Well, you're right. That makes sense when.
I got my
Yeah.
fingers crossed on that one.
Yeah. So that's an interesting article. This is an this is an article that I thought was it's the only problem with this one is a little long, but we could probably watch the first part of it. But what was very true is that maybe we watch the first part of it and I'll make my comments afterwards.
While we wait for it to queue up, sporting events was not on that list.
Yeah, you're right. It wasn't. Yeah.
And neither was choir rehearsals.
Research the last 17 years is the largest biomedical institution in the country. And I've watched some of my colleagues who have spent 2 to 3 years to define the crystal 3D structure of a protein. Well, now that can be done in 2 or 3 minutes. And that's because of the work of AlphaFold, which is a derivative of DeepMind, Demis Hassabis, and John Jumper, recognized by the American Nobel Prize in September. What's interesting, this work, which is taking the amino acid sequence in one dimension and predicting the 3-dimensional protein at atomic level, is now inspired many other of these protein structure prediction models, as well as RNA and antibodies, and even being able to pick up all the missense mutations in the genome. And even being able to come up with proteins that have never been invented before, don't exist in nature. Now, the only thing I think about this is it was a transformer model. We'll talk about that in a moment. In this award, since Demis and John and their team of 30 scientists don't understand how the transformer model works, shouldn't the AI get an asterisk as part of it? I'm going to switch from life science, which has been the singular biggest contribution just reviewed, to medicine. And in the medical community, the thing that we don't talk much about are diagnostic medical errors. And according to the National Academy of Medicine, all of us will experience at least one in our lifetime. And we know from a recent Johns Hopkins study that these errors have led to 800,000 Americans dead or seriously disabled each year. So this is a big problem. And the question is, can AI help us? And you keep hearing about the term precision medicine. Well, if you keep making the same mistake over and over again, that's very precise. We don't need that. We need accuracy and precision medicine. So can we get there? Well, this is a picture of the retina. And this was the first major hint, training 100,000 images, supervised learning. Could the machine see things that people couldn't see? And so the question was to the retinal experts, is this from a man or a woman? And the chance of getting it accurate was 50%. But the AI got it right 97%. So that training features are not even fully defined of how that was possible. Well, that gets then to all of medical imaging. This is just representative chest x-ray. And in fact, with the chest x-ray, the ability here for the AI to pick up the radiologist, expert radiologist, missing the nodule, which turned out to be picked up by the AI as cancerous. And this is, of course, representative of all of medical scans, whether it's CT scans, MRI, ultrasound, that through supervised learning of large labeled annotated data sets, we can see AI do at least as well, if not better, than expert physicians. And 21 randomized trials of picking up polyps, machine vision during colonoscopy, have all shown that polyps are picked up better with the aid of machine vision than by the gastroenterologist alone, especially as the day goes on later in the day. Interesting. We don't know whether picking up all these additional polyps changes the natural history of cancers, but it tells you about machine eyes, the power of machine eyes. Now, that was interesting, but now still with deep learning models, not transform models, we've seen and learned that the ability for computer vision to pick up things that human eyes can't see is quite remarkable. Here's the retina, picking up the control of diabetes and blood pressure, kidney disease, liver and gallbladder disease, the heart calcium score, which you would normally get through a scan of the heart, Alzheimer's disease before any clinical symptoms have been manifest, predicting heart attacks and strokes, hyperlipidemia, and 7 years before any symptoms of Parkinson's disease to pick that up. Now, this is interesting because in the future, we'll be taking pictures of our retina as checkups. This is the gateway to almost every system in the body. It's really striking. And we'll come back to this because each one of these studies was done with tens or 100,000s of images with supervised learning. And they're all separate studies by different investigators. Now, as a cardiologist, I love to read cardiograms. I've been doing it for over 30 years. But I couldn't see these things, like the age and the sex of the patient, or ejection fraction of the heart, making difficult diagnoses that are frequently missed, the anemia of the patient, that is the hemoglobin to the decimal point, predicting whether a person who's never had atrial fibrillation or stroke from the ECG, whether that's going to likely occur. Diabetes, the diagnosis of diabetes and pre-diabetes from the cardiogram, the filling pressure of the heart, hyperthyroidism, and kidney disease. Imagine getting an electrocardiogram to tell you about all these other things, not really so much about the heart. Then there's the chest x-ray. Who would have guessed that we could accurately determine the race of the patient, no less the ethical implications of that from a chest x-ray through machine eyes. And interestingly, picking up the diagnosis of diabetes as well as how well the diabetes is controlled through the chest x-ray. And of course, so many different parameters about the heart, which could never, radiologists or cardiologists could never be able to come up with, but machine vision can do it. Now, pathologists often argue about a slide, about what does it really show. But with this ability of machine eyes, the driver genomic mutations of the cancer can be defined, no less the structural copy number variants that are accounting or present in that tumor. Also, where is that tumor coming from? For many patients, we don't know, but it can be determined through AI. And also the prognosis of the patient just from the slide by all of the training. Again, this is all just convolutional neural networks, not transformer models. So when we go from the deep neural networks to transformer models, this classic preprint, one of the most cited preprints ever, attention is all you need, the ability to now be able to look at many more items, whether it be language or images, and be able to put this in context, setting up a transformation progress in many fields. The prototype is the outgrowth of this is GPT-4. With over 1 trillion connections, our human brain has 100 trillion connections. But 1 trillion, just think of all the information knowledge that's packed into this 1 trillion. And interestingly, this is now multimodal with language, with images, with speech. And it involves a massive amount of graphic processing units. And it's with self-supervised learning, which is a big bottleneck in medicine because we can't get experts to label images. This can be done with self-supervised. So what does this set up in medicine? It sets up, for example, keyboard liberation. The one thing that both doctors, clinicians, and patients would like to see. Everyone hates being data clerks as clinicians, and patients would like to see their doctor when they finally have the visit they've waited for a long time. So the ability to change the face-to-face contact is just one step along the way by having the liberation from keyboards with synthetic notes that are derived from the conversation, and then all the downstream normal data clerk functions that are done often off hours. Now we're seeing in health systems across the United States where people, physicians are saving many hours of time and heading towards ultimately keyboard liberation. We recently published with the group at Moorfield's Eye Institute led by Pierce King, the first foundation model in medicine from the retina. And remember those 8 different things that were all done by separate studies? This was all done with one model. This is with 1.6 million retina images predicting all these different outcome likelihoods. And this is all open source, which is, of course, really important that others can build on these models. Now, I just want to review a couple of really interesting patients. Andrew is now 6 years old. He had 3 years of relentlessly increasing pain, arrested growth. His gait suffered with a dragging of his left foot. He had severe headaches. He went to 17 doctors over 3 years. His mother then entered all his symptoms into ChatGPT. It made the diagnosis of occult spina bifida, which meant he had a tethered spinal cord that was missed by all 17 doctors over 3 years. He's had surgery to release the cord. He's now perfectly healthy.
Okay.
Patient
We can stop there if you like.
Okay.
was suffering.
It's a very, very interesting presentation that I wanted you to see where we're moving in medicine, that AI is going to revolutionize the practice of medicine. And one of the positive things that he's talking about is that get back to the point where the patient spends more time with the doctor spends more time with the patient, and also get the right diagnosis at the end of that. And so that's what I wanted. Any comment on that? I open the floor for any discussion on that very interesting presentation.
I think it's fascinating.
I agree.
Very fascinating. You know, I joked one time about having my annual physical on the phone with my doctor. But maybe that's the future.
Well, of course, the difference is that hopefully they can have all the data, but they can still have time to talk to you.
Yeah.
You know, that's the one thing that he pointed out that I thought was remarkable. And You have more time to talk to the patient and let the AI do a lot of the rest.
All the
But
hard work.
I thought it was good for all of you to see what our future holds and to see if you had any additional comments.
Dr.
Yeah,
Callender,
the advances in medicine are just amazing. I mean, not only with AI, but we were talking about the brain implant, the genetic editing. You know, I'd much rather see this on the nightly news than I would about the Hoopties attacking a U.S. ship. I know that's important, but you know, most people don't know the amazing advances that are being made in medicine.
Any other comments?
This is Sylvia. I think there's probably be less stress on the doctors, and I know one time we had an article about doctors committing suicide and, just depression and being worn out. Maybe this will also kind of help, it help them in terms of giving them advanced information about medical situations. So
Yeah,
fascinating.
This
This
article
is
on the screen now. I think it's talking about second opinions from other human doctors, but actually AI could be your second opinion.
Well, I think that it's better to be incorporated into the whole scheme of things and allow you to have more time to spend with the doctor so that the humanity aspect of the practice of medicine is maintained, which has been lost to a great extent. Dr. Atto, you want to say something?
Well, no, not really. Not really. Thank you.
Okay.
I also thought that the fact that they were looking at the eyes, I thought that was quite striking that they could pick up so much from just looking at your eye.
Yeah.
I've noticed when I've had my physicals, which I do annually, that the doctor actually spends a lot of time on the computer in the exam, putting in symptoms and getting feedback. The same thing that Darryl does with Google. I think doctors are doing doing that just the same as Darryl does, looking up symptoms, looking up medications, and different aspects like that. And
we've always done that.
Looking at your history, it just seems like they're doing it more and just a natural progression over the time.
We've always done it. You just weren't around to see us do it because that's usually done maybe after you leave or before. What happens is that when they had the computer right in front of you, they would do all of that right in front of you so you could see it. But often that was done
Hey,
before.
Dr. Callender, after looking at this article, I felt insulted when I was in my physical and my doctor was typing on the computer. Now I have a better feel for exactly what she was doing. I was like, talk to me. I mean, okay, you on what's going on here? And even though she would talk, but she'd go back to the computer typing in stuff. And so now I have a better feel for, I mean, even now the technology has advanced that maybe even now when I go in there and she's on the computer, I'll have a greater appreciation for what she's doing.
Well, the real solution to that problem, though, is to have scribes, because so that she can really pay attention to you and let the scribe write down those other things. Because now you don't have a scribe, and somebody's got to do it, or else she's not going to be reimbursed.
Yeah, my doctor didn't
primary
have a
care
scribe.
doctor has my primary care doctor has a scribe, and so
Mine does not.
doing all the input, and that makes a huge difference.
Yeah, huge difference. Yeah.
My eye doctor has a scribe. Has someone.
I've never heard of that. What is what is it?
That's the person
Another
taking
person doing the paperwork.
Oh
doing the
yes,
typing.
yeah. What it
Doing the
is
typing.
that you have one person, you give the history and all that, and the person writes down everything so that the doctor doesn't have to put it in the computer. The scribe or often a medical student will do that for him so that the doctor can spend all the time with the patient and not be accused of spending more time with the computer than he spends with the patient, he or she spends with the patient.
They're saying scribe, but they're putting it right into the computer as you're talking, as the doctors tell you. They have the pad right there.
That's exactly right. Yeah, yeah,
Putting it in.
yeah. Okay, well, let's let that be the last one because it's 10:30.